There it is. What's up, Charles?
Nothing much, man. How you doing, brother?
All right. All right. Uh, Making sure these things are.
What's the weather like up there, temperature?
The weather right now today was high 60s.
Well, the nighttime it drops a lot.
It's not that cool right now. It's probably about the same. I don't think it got any cooler. It's pretty comfortable in the house. Um, it was a little cool outside, but it was nice, beautiful days. It's really nice. 69 degrees here, 68 degrees here is so different than 68 degrees on Kauai.
There's no more humidity here.
Yeah, it's kind
Yeah,
of cold. It's kind of it's a little chill in the air, which is not a bad thing, really.
all right on.
Sorry guys, because I got to keep my, I usually have my setup at home and I don't have it, so I cannot. I got to monitor my comments. No, no. Oh, there we go. That's what I was afraid of. That's all right. There we go. I got to monitor my comments. There, all right, all right. How's everything going?
Doing okay, doing okay.
So big numbers for Hawaii today. Broke the 1,000 case barrier and more deaths, and including one from Kauai. Well, today's report is not even reflected in the state's report. Today's Kauai's case, Kauai's death today won't be reported until 2 days. So this thing is not slowing down. It's picking up speed. It's picking up steam. And it's kind of interesting how our state continues to monitor the situation. We might do a vaccination passport, which can require people to have a vaccine card to go into restaurants and bars. And why the hell is that stuff even open? I guess tonight we got Dr. Tim Brown. We got Dr. Tim Brown. He's with the East West Center, very brilliant guy. I think many of you might know him. I've seen his interview at the East West Center, or have seen him on the news recently. And it would be interesting because what is happening right now is what he, as well as Dr. Lee Altenberg, as well as Dr. Chiba from UH, have been predicting and have been informing our state leaders, who just they just ignore it. So we'll see where it goes from here. But it's kind of scary. It's kind of scary, Charlie, because it's like it's not slowing down. It's doing exactly what this virus is known to do. Everywhere else in the world, it's just doing what this virus does. Unbelievable.
One has to ask. It's nothing's really going to change. I would be interested to find out how much of a change things would take if we shut down. If it doesn't, because of the present saturation, right? It's so saturated. It's just like one wet carpet. You won't get it dried out until way beyond. So I guess the question would be, how long does one lock down? And what is that magic number to reopen? You see, I think the scary part is because the state has no plans. Nobody knows what the thresholds are, right? So we don't know. What do we wait till the numbers get below 100? If that takes several months, can the people of Hawaii withstand the lockdown, the shutdown? And what if the shutdown goes to a point where no movement, period, basically meaning martial law, right? Everyone stays in, nobody moves. I don't think that, if they're going to do something drastic, then you go for it. But see, I don't think they have a plan to even address that. And so that's why today I was having this discussion that it seems rather odd that when you build a house, right, some people are phobic when it comes to safety. And so they put in metal doors, they put in bulletproof glass, all of this stuff. Um, they have basically a safe room in the house because why? They feel protected where someone cannot come in, right? You have prisons where nobody can get in unless you're brought in under lock and key. You have Fort Knox that protects all the gold that the United States has. It's it's basically impenetrable. So you have all of these things, right, in the name of safety and protection, correct? And yet the state operates in such a way that we allow things to come in and then you deal with it after. So while it's already on the inner core, we're like chickens with no heads. We're trying to chase where is this spread happening? I mean, you should have thought about keeping it out first. And the thing is, you'll never know what's good or what's bad. But hey, if people want the privilege into coming into this state, they put up the protective barriers and show us the proof. At least show us something, right? Not wait until you're in the state and then we have to go and try hunt you down to find out who the heck is starting to spread this thing. That's what I don't get. That's what I don't get.
Well, what I don't get is how can our leaders, I talk from the governor on down, Keith Hayashi, the DOE superintendent, how how is it they're so blind that they can come out with a straight face and say, especially this guy Hayashi, he comes out and he says the schools are safe. There's no proof of spread in the schools. I mean, really, Lieutenant Governor coming out on his post saying that the testing, the surveillance testing, we're not talking about testing for people that test positive in close contact. Surveillance testing is rampant. And it's not. And the parents are not stupid. The thing is, how these people get up every day and continue the lie? Now, I mentioned the term lockdown, I don't want everybody freaking out. Listen, guys, it's no different than what we did in the past. Restaurants will open for takeout. It's curbing the gatherings indoors, curbing the gatherings. You still go take your dog for a walk, exercise, go to the beach. Listen, vaccine passports for restaurants and bars is not going to drop these numbers. And we'll hear Dr. Brown tonight. He's the expert. He's one of the many experts. One of the many experts that can use science and data and trends versus how you're feeling, your gut feeling. Now is not the time to be using your gut feeling. Now is the time you got to rely on science and data, and that's what we'll see tonight. But what people say, I don't understand why people say it's not fair to punish those that are vaccinated. Listen, guys, vaccinated. Wait, I get my family over here cooking dinner, making the kind. Anyway, what I was saying now. Anyway, I forgot what I was saying, but we got to figure a way to slow this thing down. We got to figure out a way to slow this thing down, and that's where
Well, let's take a breather and tell ourselves, okay, 1035, right? A place to start is what's the breakdown of the 1035? When they say something, you remember in the beginning when Kauai was always low? It's just like everybody was getting scolding, including Kauai. And we say, wait a minute. It made us almost to the point that we're getting upset because, hey, how come we're being thrown in this barrel now? We're doing everything possible to keep the numbers down. One of us are scolding the places where the numbers is going up. So the thing is, I would like to know 1035. Okay, let's begin there, boys and girls. 1035. I know the number says 4 or 500 something on Oahu. Okay, that's good. But where on Oahu? Is it all in downtown Honolulu? Is it all in Mokapu Peninsula? Where is it? Okay. Then from there, break it down. Where can you attribute? That's why it's so important that when you do these contact tracing investigations, you attribute where and the time of day. And if actual gathering it actually happened during gathering or when people were at work or what? Because the way they're making it sounds like, oh, we're going out gathering for leisure and boom, get an infection. What if gathering was at work where people was minding their own business, working, and just so happened this thing got into the air ducts and the things had to blow on everybody and everybody got infected that way? We don't know, but it would be good to know. And that way we can proceed on how we're going to fight this damn thing. But if you just blanket it across, it's not one size fits all when it comes to this virus. All I know one thing is once you get tagged, you get labeled, yeah, are we?
Well, we know what it's going to take. It's inevitable what it's going to take to stop the surge in Hawaii. We know what it's going to take, and why people keep kicking the can down the road, I have no clue. Like they believe, they hope, they think one morning they wake up and it'll be gone. I don't know if you saw the news tonight with the doctor from the Leeward side on Oahu, the Leeward community, like the community health center out there. The guy was begging people. You know what their positivity rate was today or right now? Their positivity rate on the west side on Leeward, where they're doing their clinics out on the west side, 30%. 30%. He's begging the people to stay indoors. He's begging the people to not go out and not gather with anybody outside of your family. He is asking and begging the people. And that should be what the governor is doing. I mean, this doctor is begging people. So we'll see. We'll see how it goes.
I got Kiala, and yes, tonight is Kamehameha versus Punahou. Let's not bet anything on that game, Kamehameha versus Punahou. Okay, tonight is it's serious, but definitely Kamehameha, Kiala.
All right, here we go. Here we go.
Oh,
Now,
she gonna send me another message back, guarantee.
Hello there.
wow.
Wow,
Wow,
that is
that's
nice.
that is nice. That's
But I'm not sure.
there he is.
Oh, there I am
Oh,
finally.
there.
Just takes a while to kick in.
Dr. Brown.
Just Tim, please.
Oh, Tim, thank you. I'm Mel, and the Hawaiian up there is Charlie. I don't know.
Nice to meet you guys.
I don't know if you've ever seen our show, but we're unlike what the interviews that I've seen you on with the East West Center and with the news and all of that. Ours is very informal. Ours is very unscripted, unedited, uncensored, all of that stuff. So, but the information that you have been providing now for quite a while is been pretty much spot on, and I'm so thankful that you agreed to come on the show tonight and share with our viewers. And I'm kind of going to turn it over to you. Today, as we were talking before you came on, Charlie and I, we usually do a pre-show for about 15 minutes, but the numbers are staggering. The cases are staggering. The deaths are climbing. And yet no real movement on any type of mitigation measures that you keep talking about in your interviews, that we need to do something. So that's kind of what we'll talk about. I'll turn it over to you, Doc. And by the way, people, this is Dr. Tim Brown. We can call him Tim, but he's with the East West Center. He's all kinds of things. I'll let him introduce himself because I don't want to misspeak, but maybe you can give us a short intro, Doc, or Tim.
Yeah, I'm just a senior fellow at the East West Center. Been working in infectious disease modeling for over 30 years at this point, primarily in HIV, although for obvious reasons, like most other epidemiologists, I've been dragged into working on COVID in the last couple of years. Kind of an occupational hazard at this point. But fundamentally, I've been, analyzing the situation here in Hawaii, trying to look at what's going on, keep track of the trends, try to understand what the data is telling us. And of course, even as early as last March and April, My colleagues, Sumner LaCroix, DeWolf Miller, and I were all basically writing pieces on how Hawaii should be responding, how we should be addressing the epidemic, what we should be doing moving forward. So, this is just kind of my current work is an extension of that earlier work.
Well, Doc, let me start off by asking you a real, I think the layperson out there have been begging this question because we're definitely in this together. But based on what you've seen, I sort of get the impression that for some reason this administration either is being ill-advised or it's almost as if doing nothing is their answer for gaining something. What's your take on it? It seems like there's no movement, like Mel said, there's no movement happening. And it seems rather dangerous because when this thing first started off, we kind of knew that if you don't do anything, the numbers are going to climb. And yet COE has the data to show that when we went into the two-test process, we were able to hold everything down. That's why we opted out of the Safe Travels program. And then we got it so low and nothing was moving, we opted back in. And by opting back in, it kind of showed everyone how dangerous it can get by the numbers starting to climb. What's your take on it, Doc?
Well, I think, my concern is that, like you say, the situation is much worse than it was last year. We're absolutely seeing, can I share my screen here?
Sure.
Let me just put up a slide showing kind of where we were last year and where we are this year.
Okay.
Is that coming through?
It's saying that there we go.
There you go.
Oh, okay, it just takes a while. Sorry, wrong one. There. So, this is basically the graph of what the epidemic looked like through the entire course of the COVID epidemic here in Hawaii. And you can see we did have a bit of a scare last July. Just about 2 weeks after the 4th of July, we saw a sudden rather rapid rise in cases. But that peaked out at a 7-day average of about 240, 250. And then it fell off, and then we stayed at a relatively low level for a long period of time with a couple upticks around Christmas, Thanksgiving. That's not surprising. Again, the holidays. And then we were kind of in this nice kind of steady, slow decline. And that basically was the impact of the vaccines because we were scaling up vaccines very rapidly at that point. And the variant that was dominant at that time was either one of the New York variants or growing toward the end of this period, we were starting to see the Alpha variant, the one that started in the UK. And so we were seeing this nice kind of slow, steady decline. Everything was looking good. And then after the 4th of July this year, we just exploded. Literally exploded. You can see the sharp rise that is still continuing through today. Everyone knows we basically had our highest number of cases today if we disregard the reporting glitch that occurred a couple of weeks ago. We had 1,035 cases on a statewide basis today, which is by far the highest number that we've seen. And the 7-day average that's showing up now at around 750, 760. So, we're basically generating 750 cases every day. And that is really stressing our hospital system. It's causing a lot of problems that are becoming obvious. We're seeing it on the news every night. We've got the doctors in there every night telling us how they're overloaded. The hospital administrators telling us that they're starting to prepare for surge capacity and so on. Every night we're getting news stories about different hospitals going on divert and sending people from one hospital to the next. So clearly we are not responding in accordance with the magnitude of this growth of the epidemic. And I do think, like you say, there has been an issue there. And it is a concern because we know that hospitalizations lag the growth of cases by about 10 days, and then deaths lag by about 2 weeks after that. So, fundamentally, if we actually pull up the data from the US, this is when the cases started to rise. 10 days later is when the hospitalizations start to rise. And then about 3 weeks after that is when the deaths start to rise. And so that's what we're seeing now. We're seeing the hospitalizations rise very, very rapidly. If we actually look at the HEMA website, we are now much higher than our peak before, which was around 300. And now we're up to over 430 cases is basically what the HIEMA website is saying today. So clearly we're in a critical situation as far as our healthcare capacity goes. We've got, I believe, about 2,400 hospital beds in the state. Right now, 400 of that, so 20% of those are basically being taken up by COVID cases, largely unvaccinated people. I think the latest estimate on, the only data we get on this is basically from Josh Green's website. And his latest data, I think, was about 11.5% were vaccinated and 88.5% were unvaccinated. So it's primarily unvaccinated individuals who are ended up in the hospitals because the vaccines are working really well in terms of preventing hospitalizations and deaths. They're doing exactly what they were intended to do. And so I do think, yeah, we're in a very serious situation. And I don't understand the slowness of the response, to be quite honest. Several of us have been pushing for some time. It was actually obvious, even back in mid-May, to some of us that this was coming, because we were tracking what was going on with Delta in Singapore and in the United Kingdom. And in those places, basically, we saw the epidemic playing out. We saw the growth of the cases. We saw Delta basically kind of force out Alpha and take over as the big kid on the block. And so we knew this was coming. We also watched through June and July the growth of Delta within the United States as it went from only 2% of our cases to where by the end of July, it was effectively 98% of our cases. Okay, so it was pretty obvious this was coming. And we tried to warn people. You know, I'm on record actually in the Star Advertiser warning people about this back in mid-July when the cases had just started to rise, when it was really time to start focusing on this, because like I say, if you were watching the data from other places, you knew what was coming with Delta. You knew that this spike was about to happen. And yet somehow our leaders, and it's not just the state leaders, you know, I've got to be honest, we got to put this at CDC's doorstep also. They completely failed to anticipate this. They honestly did not really discover Delta until the week after the 4th of July. That's when all of a sudden they started to realize we've got a real problem on our hands. You know, you'll recall, I mean, we were talking on the 4th of July about how, oh, everything's over. We're back to a normal summer now. And 2 weeks later, we're back in crisis mode with hospitals filling up throughout the South. Okay, so like I say, this was not unanticipated. If you were paying attention, you knew it was coming. And we tried to warn people, but the policymakers have been very, very slow to take the message. And I really don't understand it, especially given, you know, what we've seen with hospitalizations right now. And like I say, they lag the cases by 10 days. So this is a lagged hospitalization rate. And I think Josh Green himself has said that we're probably going to see another 300 to 400 hospitalizations over the next 3 to 4 weeks. So we're looking at a very, very high burden on our hospital system that really is unsustainable at this point. So yes, it's a crisis situation, and I would expect that we'd be making crisis responses, but I'm seeing very timid steps forward, and that is a real concern.
Well, I think the other thing that and thank you very much for this. I mean, this is a clear evidence where we're at right now. But, you know, as a user of the medical system myself, having open heart surgery, I know how important it was to be basically unobstructed, you know, having that access to go straight in. So basically what you're saying is that if this continues, if I was to be in that same situation again, and you know, heaven forbid, but if, or those who are looking at situations like that, the opportunity of going in may not be so readily available. That's what you're saying, right?
I think that's correct. And I think it's a product of two things. You know, COVID is obviously one of those things, which is producing a lot of hospitalizations. Like I say, 20% of our hospital beds now are basically filled with COVID patients. But the other thing is that we always had a healthcare system that was kind of running at the fine, hairy edge anyway. You know, and this is part of the profit-driven motivation of our healthcare system in this country. Rather than building adequate surge capacity within our healthcare system, basically to deal with a lot of additional problems that may come if a pandemic comes, or if, for example, a major hurricane produced a huge number of casualties and fatalities here, Rather than planning for that, we planned for what was kind of sustainable in terms of keeping the cost low, but basically not building more capacity we absolutely needed in a normal time. And the problem is this is not a normal time anymore. We've now got 400 additional hospitalizations added on top, and probably in 2 to 3 weeks, we'll be talking 700 or 800 people in the hospital. And our system is just not set up to handle that. And that's why we now have tents outside of the Queen's emergency room, outside of Hilo Medical Center. Basically it's because our system was never set up to handle this type of surge. And so the other problem we've got right now, though, is I realize the hospitals are planning for this. But if we really do believe that we're going to end up with 700 or 800 people in the hospital inside a month or so, we basically need to be getting additional facilities, triage facilities ready at this point so that we can handle that load when it comes. So that, like you say, we can hopefully still provide for the other medical needs of the people of the islands. Because that's a real concern for me. We've already seen stories on the news. For example, a woman who was going in for a mastectomy, it's basically been put off at this point. She hasn't been biopsied yet. We don't know if that's going to metastasize or not. This could actually be a very dangerous problem for her, that she can't obtain the medical care she needs right now because the hospitals are filled with COVID patients. And there are going to be many, many other cases like that. Like you say, people who need open heart surgery or who basically have a stroke. If they can't get to a hospital emergency room in a timely fashion, that's going to be a major issue for those people. And so I realize the healthcare workers and the administrators are trying to do what they can to triage those situations. But we need a stronger prevention side to this, not just trying to clean up afterwards. And I'll be quite honest, I think from the start of this, we have had far too much emphasis on not overstraining hospital capacity and too little emphasis on actually preventing infection, which is what we need to do. If we prevent the infections, we never stress the hospital capacity. But, we've hesitated to do that. This in the last month and a half, we've seen this coming. We've known this was coming. The cases have been rising every day, and yet we haven't done anything. What have we done? We changed the capacity limits from 25 to 10 indoors, which means I can now gather 10 people from 10 different households indoors without masks in a restaurant and spread COVID to all 10 households. That makes no sense to me. That's not a restriction that made sense. The restriction we had last year at this time was 5 people indoors from the same household. That made sense because those 5 people, if they're unmasked with each other all the time. So there's absolutely no problem with them taking their mask off if they go to a restaurant or something. When I'm talking about 10 random people from however many different households they may come, it's just an opportunity for COVID spread. And I walk by these restaurants every night and I see 30, 40, 50 people sitting in there, no masks, some of them a foot and a half away from each other, talking loudly in each other's faces. And that COVID is being transmitted in those hospitals. And our cluster reports show it too. Again, let me share my screen.
I guess that was always my question, is why are we not attacking the source of infection? Why are we being so reactive? Why are we waiting and not going after the source? In other words, going after the spread. That has always frustrated me to no end. I mean, I just don't get it. We're not going after the source. We're allowing the source to.
Yeah, let's look at our latest cluster report. Okay, this is the cluster report put out on August 19th by Department of Health. Okay, restaurants on Oahu, 10 clusters. And these are the ones that they detected. We know there were additional clusters that they didn't pick up because we know they have problems in contact tracing reaching many people. Many people, like they say, won't even pick up the phone. They've told us that repeatedly in the last couple of weeks. So we know that they're missing things. We've had 10 clusters in restaurants on Oahu. Over on Maui, we're getting travel, lodging, and tourism, construction sites, occupational settings, workplaces, basically. Where again, people get around a lunch table, they take off their mask, and they're sitting there yapping away for an hour. Okay, that's how COVID gets transmitted. We had one very highly publicized outbreak like that in Honolulu Hale last year, right? Where people sitting around the lunch table basically infected one another. So we know that happens, but we're not taking the steps basically to prevent that. And that is a real concern here. And I don't know why we're not going after the sources. The data is there to show us where the sources are. Obviously, there's business pressure to keep the restaurants open. But again, if we're seeing so many clusters in the restaurants, that tells us right there, this is a major source that we basically need to address. And, we're starting today, I think for the first time, we're seeing Mayor Blangiardi on Oahu, finally starting to talk about actually putting vaccine mandates in place for restaurants. Okay. And something like that is absolutely critical because that will cut the transmission in the restaurants significantly. And I think that that's a really important thing that we need to be focused on and we need to try to emphasize in what we're doing. So I do think, we're finally starting to see some action, but we're 6 weeks into this growth. This started back on the 4th of July. So, almost 2 months at this point. And we've done comparatively little in terms of actually responding while our hospitals are getting overwhelmed. So no, I don't understand it either.
There's one area that with in relations to your the graph there of the Department of Health is I look at correctional facilities because we've gone through the first phase when COVID first came out, and we saw how the rise of cases in OCCC and how late of a response what happened. We're now getting word from actually ACOs, the guards themselves, because they were on the show, saying that there they go again, new bodies that come into the facility. Instead of being separated, they're taking infected ones, known infected ones, and housing them with non-infected ones. And next thing you know, you just have a big cluster of infections. It's starting up again. And we're kind of wondering, we're kind of shaking our heads because if it repeats itself what happened the last time, these people get sick, the medical unit in there is not equipped to handle that numbers. Those numbers come out and get added into the facilities outside, like a Queens, like a, Polymomy or someplace of that nature. So everything you said, Doc, and I applaud you for it because I agree as well that we've gone way too much into a reactive mode when we should have been in a proactive mode right from the get-go, right? Because that's what we do, right? You get an earthquake thousands of miles away from us. What do? They tell us prepare, get ready in case it hits. Something like this, you see it coming, and everybody just takes their time, have a leisurely stroll, and basically the feeling I get is, well, we'll deal with it when we deal with it. And look what happens now.
Yeah, well, I think, especially with a pandemic of this sort, you need to anticipate it. If you don't get ahead of it, you're forever going to be playing catch up, and you will never catch up with it. And I think that's the situation we're in right now, unless we start taking much more proactive measures. Vaccine mandates are a first step in the right direction. I sincerely hope that the mayor adopts those on Monday. I was just watching the 6 o'clock news. There are hints that some announcement is coming on Monday. Now, why that announcement can't come this afternoon so that we actually have it in place for the weekend when COVID transmission will still be occurring, I don't know. It's just, I guess, easier for the Monday news cycle. But, yes, we need to start treating this like the emergency that it is and not just acting like, well, a few more cases today, a few more cases here, a few more hospitalizations. No, our system is under extreme stress at this point. We're already seeing elective procedures canceled. Queens did that some time ago. Kaiser joined them today. Kaiser has now canceled elective procedures. So again, a lot of people who have urgent medical care needs basically are having them denied now because our hospital capacity is so stressed. So we are in a crisis situation now. And, almost 3 weeks ago now, I believe, both the governor and Dr. Char used the term crisis in their press conference, but I have not seen a crisis response. What I've seen is a very slow, very halting, I'm not sure we want to do this sort of response. And it's been that way almost since the start of this epidemic. I think we saw some action early last year. I think there was, Mayor Caldwell basically shut down Honolulu very, very early. And then the governor issued a statewide proclamation about a week later. Okay, but we're not seeing that kind of action this time around, even though the situation is much, much more severe and serious.
Yeah.
I think the pressure from the business community, from the visitor industry is quite high. I just don't get it. I mean, at this point, like you said, it's the difference from this year to last year is incredible. And all we hear is that we're monitoring, we're monitoring. I'm not sure what the monitoring is. In the meantime, we have schools. Yeah, we have restrictions put on gatherings, but yet the schools are free to go. And then you hear them say that there's no spread happening in the schools. Doc, I mean, really, it doesn't take a rocket scientist to figure out if 10 grown men sitting around the or women sitting around a table during a lunch break talking and it's creating spread, 30 kids in a classroom 3 feet or less apart from each other are going to spread the virus. What are your thoughts on the school situation?
Well, I think, again, we're told that mitigation procedures are in place. But again, the concern I've got is the anecdotal reports we get from the teachers, from the unions, from some of the parents, that in fact, these mitigation procedures are not being enforced, are very lax. And so we really don't know what's going on in the schools. And I think that is a great concern because 135,000 of the 180,000 school kids in this state are not vaccinated. The majority of them because they're under age 12. And so they're not even eligible for the vaccine at this point. And only about 50% of those above age 12 are fully vaccinated. So we've got a largely unvaccinated population sitting in these classrooms. And if the mitigation procedures are not being well implemented, and again, like I say, we have no way of knowing what's actually happening there. I mean, one check on that would be if we had actually set up adequate surveillance systems within the schools so that we were doing systematic testing every week at a number of the schools and finding out what was going on. But no such system is in place. Instead, we have this rather ad hoc system where the schools kind of report cases that they find by hook or by crook, by whatever means they find them.
Mm-hmm.
And we're not seeing a systematic surveillance of the schools, at least not that I'm aware of. I've seen no reports of anything systematic like that. If we had that and that was staying low, then I would be comfortable saying, okay, the mitigation procedures are working. But in the absence of that, I really don't know what to say at this point because, we have seen, I haven't actually looked for the education report this afternoon to see how many cases were attributed to the schools this week. But, it was like almost 70 something the first week. It was 300, I think 20 the second week, and it was 380 something last week. I don't know what this week's is, but again, that's concerning. Now, again, they make the argument that a lot of those cases basically aren't related to schools. They occurred in community spread. But again, how do I know that? And how do I verify that?
I just heard the news tonight. They said it was over 500 students and staff this week.
Yeah, and that's the problem. It's growing every week.
Mm-hmm.
And that does, and like I say, it's not a systematic survey that we're looking at here. So it's basically just those that they happen to pick up. And also with children, you can have a lot of asymptomatic transmission. Okay, a lot of children can contract COVID, but they won't show symptoms. That doesn't mean that they're not capable of spreading. We know very well with COVID that asymptomatic individuals can spread. And with Delta, that is particularly true. Delta produces higher viral loads and basically asymptomatic spread pretty much as efficiently as symptomatics with Delta. So there are real concerns we've got here about what's going on. And I'd like to see some, really solid surveillance being done in the schools. So again, we could have some confidence that the schools were safe at this point. Honest truth, I don't know at this point. I can't say. And I suspect it probably varies from school to school.
Right.
Some schools are, the principals are probably paying a lot of attention, are being very careful and are implementing the proper procedures. Other schools, I would wager, are much more lax. So I think it probably varies from place to place and maybe even from classroom to classroom in some cases. If you don't have kind of good monitoring of these sorts of things in a school, then you're not really going to know what's happening within the different classrooms. So I do think, there are a lot of issues that need to be addressed there to make sure that the schools are safe when we're sending our kids back to them.
That's one of the things that, Mel and I talked about before. From the first COVID outbreak to now, we hear that mitigation measures have been put in place. And I've always asked, okay, what are they? What are they? Just tell us. I know that it seems as if the thing they commonly said is, okay, we know that there was a debate between the 6 foot and a 3 foot distance between the desk of the child. And we're like, okay. Then, one of the questions was that because we know that this transmissibility was much greater, airborne wise, I said, did anybody go into the classroom to look at the airflow of these classrooms? I said, if air loves to funnel through the tightest spot, right? So if you got any kids sitting by the door and you got the windows the other side, guess who's going to get the most blast? And so what's even greater now, since I've been involved with disinfecting here on Kauai, is just having small talk with those who ask us to disinfect the buses. How many kids were sitting in that bus? Or, what were you told? And I'm very amazed at some of the information because, the bus operators are just the operators, right? They're not going to be told, well, we're really looking at the kid is sitting in the third seat on the aisle. We're looking at the seat in front, seat in back, sitting next to the person, and the person on the other side of the aisle. Well, guess what? There's really no draft in that bus except for those side windows because there's no back windows. So I said, so if the kids had the windows open, guess where everything is floating? All the way in the back and collecting in the back. If one had to look at it that way. So it gets very, very very testy in a way, because when the kids through contact tracing find out what bus they rode, then the question becomes, okay, when they were in class, how active were they in class? Were they moving about? I'm sure that during a break, they didn't just stay isolated in the class. They moved somewhere on the campus, right? When they went to the restroom, when they went into the cafeteria. Yet, just by knowing what we're disinfecting, we're not going into those areas. So I said, how can we disinfect a bus, but not disinfect a classroom, or not disinfect a restroom, or not even disinfect the cafeteria? Is it that Delta said, we're just going to stay somewhere in the bus?
I think I'm less worried about disinfection in the sense that, yes, I mean there's probably some transmission through fomites. In fact, there's actually one recent study of hamsters that does demonstrate that they can get infected basically through the food bowl and things like this. So we do know that that transmission is possible. I mean, there's big arguments over what fraction it is. It's probably comparatively small with COVID though, because it is so effective basically through droplets and through aerosols. And I'd be less worried about the bus actually than I am about the classrooms. Because at least in the bus, you can open those windows and that will keep an airflow going. The air will be turning over in the bus fairly quickly. But in the classrooms, it depends on the ventilation system in that classroom. And what I would really like to see is what they're doing in places like Belgium, where they're actually doing internal monitoring of CO2 levels. Because if the CO2 levels are climbing, your ventilation, your air turnover is not good enough. In fact, I mean, there's typically a certain level that's set. I think it's about 800 per milliliter. That basically, if you don't have that level, if the CO2 goes above that level, you don't have adequate ventilation in the room. And that's something that's fairly simple to monitor. I mean, you can buy those CO2 monitors on Amazon for 60, 70 bucks. They're not expensive. And, if I were setting up the schools and worried about ventilation, which I would be, then that is one of the things I would probably want monitored in every classroom. And it could be done at comparatively low cost. And for that matter, we can probably use CARES money or something basically to pay for it.
Yeah.
But we should be looking at those things because I think ventilation has been kind of the overlooked piece of this, because spread occurs so much more in indoor places. And it really is a function of what is the ventilation in those places. If the ventilation in the air turnover is not good, then COVID will build up in there and you will get a lot of transmission, which is why bars and nightclubs are so notorious for super spreader events, because they typically have very poor ventilation. They basically, bring in huge numbers of people, breathing very hard, dancing, having a good time, drinking, not wearing masks. And so it's the ideal situation for COVID to build up and infect a lot of people. And so, I do worry about that. And I do think we haven't paid enough attention to ventilation throughout this.
No, I think we haven't paid much attention to a lot of things. One of the things you talked about in the schools, and I'm concerned overall is the surveillance testing. You know, there was a time where there was a lot of surveillance testing going on last year. Again, when everything was much less of a crisis, we had many more preventive measures, but the surveillance testing. Now, Dr. Dara O'Carroll shared this with me today. I'm going to share my screen and just. I was not aware of this, Tim. I'm not sure if you were aware of it, but the influenza surveillance program. Are you aware of this?
Yeah, they've been tracking COVID as part of the influenza program for, well, since I think like March of last year, actually. Sarah Park, before she left, basically had started to build that into the influenza surveillance program.
But we don't see the surveillance testing. I wasn't aware of this, and it's kind of, I read this today, and it was kind of surprising because they don't really track all the influenza. I'm not sure how they sentinel providers and so forth. But what's interesting is why did we have, and this is the segue to my next question, why is influenza surveillance important to Hawaii? And it talks about because of our isolated location and huge tourist volume, Hawaii's influenza trends, let me get rid of this thing here, during any given year may be very different from that of the United States or any other parts of the world because of the huge amounts of visitors coming in, I should say travelers. Now, we have been pounding this drum for a long time, many of us have, as far as the testing of the travelers coming in, not just to tourists, but the residents that are returning from vacations or whatever, business trips. Mm-hmm. And we're very good at that. And Kauai is a very good model to follow. When we opted out of the Safe Travels program and we put in the bubbles and the quarantines, the numbers dropped really quickly. And it stayed down there. The moment we opted back in, it just popped up. So we know one thing, aside from all the other mitigation measures, we know that if we went back into the two-test process, that we would drop these numbers at this current moment. It would drop. We would drop a lot of these cases every day because we've seen that happen in the past.
Well, I'd be cautious about that right now because Delta is that much more transmissible. The community spread is probably what's dominating on Kauai now, just as it is in the other islands. And that means that cutting off the influx of infected tourists probably would have a much more limited effect this time around than it did last time, because just Delta is already there and is spreading basically among the community. And so I do think that's an issue. I do think, certainly the probably more important component of travel is local residents returning home, because the challenge that you have with them is, yes, they may get tested before they come. That's, generally been a requirement, although now they can get in with just the vaccination, which we know is inadequate, given that we know basically vaccinated individuals can contract and transmit COVID. So that testing should absolutely be re-implemented. Although 72 hours is probably too early to do it. We probably ought to, if I had my druthers, I would be doing like a 48-hour test beforehand. And I'd probably be doing a post-arrival test as well. Mm-hmm. Because Delta evolves within the body much more rapidly than the older variants did. The average time between infection and first positive PCR test is 4 days with Delta, whereas it was 6 days with the older variants. Okay, so it evolves more rapidly. That means having a wide testing window means that you may actually let a very active infection slip through. So there are concerns there. But I am much more worried about the returning residents because they go back into our communities. Mm-hmm. The tourists, to a great extent, other than when they're going out, out and about on tours and other things, are largely, spending a lot of their time at the resorts or on the beaches and so on, where transmission's probably, at least on the beaches, is comparatively low. And in the resorts, they'll be transmitting among each other, not so much, except for local staff, of course. But those local residents who return back into the population, if they don't practice self-quarantine after returning, could be spreading in their workplaces, in their homes, in the restaurants, in the places where they're shopping. And that, I think, is the real concern. And is actually kind of interesting. If you look at the DOH numbers for July and August, or June, July, and August, they were actually putting about 15% of detected cases basically on travelers, with the bulk of that, like 12 to 13% of that was basically returning residents. They were saying 2 or 3% coming from the, mainland tourists who are coming here to visit. Now we are probably underestimating the mainland tourist contribution just because we're not going to pick them up, because most of them, a lot of them are coming in vaccinated now. They're coming in with a pre-travel test if they're not vaccinated. And so I think that, they're a cleaner population comparatively than we may be dealing with people who are going to Las Vegas, where, masking was only reinstituted about a month ago and was clearly a major hotbed for spread of COVID. So it's those returning residents that I worry about. And, there ought to just be kind of a rule of thumb that returning residents quarantine for at least 10 days after they get back. And I realize we can't enforce that because we've never enforced quarantine in anything approaching a reasonable manner. We should be setting up quarantine hotels designated the same way they do in places like Australia and so on. We don't do that. We allow people to quarantine at home on the honor system. And we know that, unless they feel sick, or even if they do feel sick, they may still feel they have to go to work because they can't afford to be without pay for a week. So I think, there's a lot of issues around that. And like I say, the June, July data was already showing 14, 15% basically coming from that source. So that clearly is a source. And then that's contributing to the community spread as well. So it's not something we should disregard.
Yeah, and that's, I think Charlie and I make it really clear that it's travelers and not visitors. But when we get that virus in, and whether it's a resident or a tourist or whatever it is, and that's how we get community spread. It starts with something that came in. Now I'm even more concerned now as we start hearing about the other variants that are brewing out there, Lambda. If we don't have an effective way to screen, and maybe it's not as concerning as I'm hearing, but if we don't have an effective way of screening our travelers, returning residents or visitors, is there a chance we could let in one of the new variants coming in?
Well, I think the bottom line is, I'll be quite honest, I don't think we can stop a new variant from getting in, at least not as long as we're open for tourism, because we just bring in people from too many different places. And it doesn't matter that, now we're primarily restricted to US tourists, because those US tourists were in London last week. They were in Abu Dhabi 3 weeks ago. Some of them were in Asia not too long ago. So, people travel everywhere. So to say that, you're only accepting people from certain places and that makes you safer really makes no sense, because we have had 4 different waves of COVID in the last 20 months. Okay. We had the original Wuhan strain. We had a mutation called D614G, which took over the entire world in 2 months in March and April of 2020. It basically went from probably evolving in Europe initially, and it literally spread across the world inside 2 months. We then had Alpha come, which started in the UK in December, and basically by June had pretty much taken over the world. And then Delta came and basically dethroned Alpha in record time. Delta basically started in India in April and basically has completely dominated the global pandemic now in every country, virtually everywhere, except South America, where Lambda is an issue. But again, so far, we haven't seen any solid indications that I've seen that Lambda is a real threat in terms of outcompeting Delta. I think so far, Delta is the established champion. But again, remember, Alpha was the established champion until June of this year. And then Delta basically landed a real knockout punch and basically just took Alpha out of the game almost entirely. So, this situation is very fluid and it can evolve very quickly. So I think what's more important than necessarily just trying to prevent the entry is preparing for the entry. It's watching what's going on in other places of the world, and especially in those countries that are doing good surveillance. For example, the UK. I mean, in the UK, they sequence something like 50% of their samples. Okay, so they know what variants they have. They've got very good data. They can tell you, okay, we've seen 44 cases of Lambda so far. And I think that was the last number I saw. That's probably dated by about a month. But they haven't seen Lambda kind of forcing out or pushing out Delta. But they did see Delta come in and basically force everything else out. So we've got to look at those countries that actually have good data, which sadly does not include the United States anymore. CDC has done a pathetic job of organizing data on COVID. They were blindsided by Delta, which they never should have been. It was clear what was going on with Delta. You know, I mean, and honest truth, I think CDC let President Biden down. They had him out there on July 4th talking about how we basically had kind of put this behind us and so on. And yet it was very clear at that point that Delta was in the wings. I'd been telling everybody at East West Center for the last 3 months that this was coming. And, you know, you might want to rethink our reopening plans because this is coming and this is what's going to happen. And it's exactly what we're seeing right now. It was completely predictable if you were paying attention to the rest of the world. And I think our problem is CDC focused too much on rather poor US data rather than on the solid data systems in places like Singapore, the UK, and Israel. Those people have solid national data systems that collect information on every case. I mean, when you see a study coming out of the UK, you're talking sample sizes of 700,000 people, 800,000 people, you know, because that's the number of people they've got in their medical system who've been dealing with COVID. When you look at the vaccine studies come out of Israel, the first study out talked about the first 4.7 million people receiving the vaccine in Israel because they had data on all of them. They knew the breakthrough cases. They knew how many had been infected. They knew whether they were symptomatic or not because they had solid data. We have not had that luxury here in the United States. And in fact, CDC back in May, when they made the extremely regrettable mistake of telling vaccinated individuals they could stop wearing masks, which my epidemiologist friends and I were all screaming at the television at that point in time, I'll tell you. They, at the same time, basically said, we're not going to track breakthrough cases. We're only going to track hospitalizations and deaths. And even there on breakthroughs, they've done a terrible job. If you actually go to the CDC website on breakthrough cases, you'll see something like 9,800 cases, I think, was the number earlier this week. And on the website itself, it says, well, this is based on only a small number of states that report this data, and we believe it's undercounted. Well, why haven't they fixed the data system? And why aren't they tracking breakthroughs regardless of hospitalization and death? They should also be looking at breakthroughs, just cases that test positive who've already been vaccinated, because we need to understand that. We need to know what vaccine did they receive so we can know which of the vaccines are actually failing in the face of new variants. We need to know, you know, how severe was their illness? Because, you know, what we're trying to do is piece together things from a lot of anecdotal data. Okay, we know, for example, from anecdotal data, we know that most of the breakthrough cases who end up in the hospital tend to be people who are either very elderly or they have some other major comorbidity. Okay, but we don't have solid data on that. We only have reports that we get from different places and different states that maybe have collected this data this time, but we do not have a systematic national surveillance system that actually gathers this information. And without that, CDC is flying blind. And so, you know, they can't give the right recommendations to the country. I mean, you know, they discovered asymptomatic transmission from vaccinated individuals only after they got their data from the outbreaks in Massachusetts. You know, the July 4th outbreaks in Provincetown. And basically that's unacceptable because there was studies back in April and May in India that basically showed the breakthroughs among healthcare workers vaccinated and showed high viral loads and ongoing transmission and superclusters among vaccinated individuals. The data was there. It's just we didn't look at it because it didn't come from here. And I think that's part of our problem. We don't have a wide enough view of the data across the world and pull it all together and try to make the best use of it to synthesize an understanding. And I think that's a real issue.
You know, as I'm listening to this, you know, both Mel and I were former law enforcement officers. So, you know, when terrorism first, you know, post 9/11, everything was you build the greatest surveillance information gathering and you build your partnerships with all parts of the world. So, you can track, ISIS, you can track every terror organization, and they do it well. And for some reason, the United States really grabs onto that to protect our borders, right? And, I think they've done a great job.
Mhm.
But for some reason, the importance of Delta, because it causes just as many deaths, right? COVID causes just as many deaths.
Far more.
Yeah.
Terrorism
And-
has not killed 600,000 people in the United States in the last year. COVID has.
Yeah. And so when you look at that and you got what you say, all this important information that can be shared, because everybody gets on the network and it's so highly sensitive, I will wonder why we're not grasping onto it like we grasp onto terroristic information. It's beyond me.
Well, I think, part of the problem we've got is that when it comes to public health, this is going to sound strange to you. In some ways, there are almost too many scientists in public health. By scientists, what I mean is people who insist that they've got to have a randomized control trial before they will believe anything. And when you're in public health, you can't do that. When you're in public health, you have to work off incomplete information, just as you do when you're dealing with terrorism. You work off incomplete information, and you have to build up the picture. You have to understand and put all the pieces together, synthesize all the data that's available to you to get a picture of what's actually going on with the epidemic. And that is a special skill set that not everybody in science has. I'll be quite honest with you. There are a handful of people, I think, who've really got that synthesis ability. And, and some of them are, out there and are speaking up, but there aren't enough of them. And so we have too many people who are, relying on studies from a year ago. Well, studies from a year ago don't apply to Delta. Sorry, folks. Some of what's there applies just because it's part of the biology of the virus. But a lot in terms of transmission, in terms of natural history, in terms of symptoms, in terms of fatalities, what applied to the wild type and to Alpha does not apply to Delta necessarily. Okay, there are similarities, but Delta is clearly much more transmissible. And that makes a huge difference in terms of how the epidemic plays out. And let me actually just show you a quick example to show why that transmissibility difference is so critical. Let me share my screen again. Got the right one here. Come on, there we go. Okay, this is, blow this up. The original COVID-19 virus, the variant that came out of China, okay, had an R0. R0 is, in the absence of all interventions, on average, how many people will an infected person infect? Okay. And so for the original coronavirus, COVID-19 that came out, the R0 was about 2.7. So let's say 3 people. The average person, in the absence of any interventions, not wearing a mask, not taking precautions and so on, would infect about 3 other individuals. So what does that mean? Well, it means, let's take a transmission period. The transmission period for Delta or for COVID is about 2 weeks, because that's the time during which the person is symptomatic. They can shed virus for probably about 10 days of that. So over the first 2 weeks, if a single person starts with an infection, in the absence of interventions, they're going to infect 3 other people. Okay, that's the first transmissions. So at the end of 2 weeks, we're going to have 1 plus 3. We're going to have 4 people infected. Okay, starting from 1. Each of those people over the next 2 weeks will infect 3 other people. So at the end of that, I've got 9. If I extend this out to a third transmission cycle, which would be about 6 weeks, I'm going to get 27 more. So I'm going to end up with 40 infections. Okay, so 1 person over about a 6-week period in the absence of any interventions with the original COVID would produce about 40 infections. Now let's look what happens with Delta. Delta's R0 is about 6. Okay, it infects twice as many people over an infection period as the original COVIDs did. So that single person now infects 6 people during the first transmission cycle. Each of them infects 6 people in the second transmission cycle. Each of these people will go on to infect 6 others in the third transmission cycle. So after 6 weeks now, I'm going to be looking at 259 infections compared to the 40 infections I had with the original COVID. This is why Delta is so much more serious. It's the exponential growth factor, which plays out at the population level. It's not the individual transmission. It's basically what happens at the population level. And now let's see what happens if I throw a vaccine in there. And I'm going to throw in a vaccine that's not even perfect, right? We started out with vaccines that were 95% effective, right? They would completely stop the epidemic for all practical purposes. And they did that. And they were working very well at that level with Alpha, but then Delta came along. And now with Delta, in fact, the latest CDC study that just came out in healthcare workers says that our current mRNA vaccines, the ones that we're using mostly in the US, are about 66% effective with Delta. Okay, so let's look at that Delta person now. Well, it's 66% effective. So yes, this person can still infect other people. Okay, but 2/3 of them are still going to be protected by the vaccine. So the single person will now only infect 2 others. Each of these others in a fully vaccinated population would then only infect 2 others. So look over 3 transmission cycles then. I end up with only 15 infections, as opposed to 259 if I'm dealing with unvaccinated people and 40 with the original virus. Okay, so even with an imperfect vaccine, where the vaccine's not perfect for stopping transmission, I still end up cutting the number of new infections immensely. Okay, this is why things like vaccine mandates are so important. Because if I mandate vaccines in those restaurants that are producing the clusters of infection, then I will reduce the transmission in those restaurants from this 15 to the 259. Or sorry, from the 259 to the 15. So I will radically bring down the transmission. And that's what's really important here. And that's why I'm hopeful that on Monday, Mayor Blangiardi is going to announce that he will be putting vaccine mandates in place for restaurants. I'm hopeful because I still don't know. He's hinted that, but again, it's in discussions with the governor, et cetera, so we don't know yet. But if that happens, it will go a long way towards stopping the transmission that's occurring in restaurants, which is a big part of our problem. Now, it's also happening in social gatherings, it's happening in gyms, it's happening in bars. So, you've got to apply that across all of those types of places. But even if the vaccines are not perfect on transmission, they basically can really cut our new infections immensely. And the other thing to remember about the vaccines, they're almost perfect on hospitalization and death. They're 90% protective there. And that's why 90% of the people in the hospital now are the unvaccinated. The vaccinated people, unless they've got another major comorbidity, are generally not ending up in the hospital. Okay, so the vaccines do work. They work both on illness and death, and they work also on transmission. And I think we're underplaying the transmission benefits of the vaccine and the way they will play out at the population level. And I think it's really critical that people understand this.
So let me ask one last question on my end. And it's only because I kind of look at a lot of things that's coming through the airport, especially using the vaccine. Okay. What about those? How does it figure into this overall scheme with how the vaccine works? And that's given the numbers that you just shown. That's given if everybody just straight up and say, yeah, I've been vaccinated, right? But what of those who do the pretend vaccine, meaning, going through those fraudulent vaccine cards and all that, where they're not vaccinated? What do you think that could potentially play in those numbers? Because I like the big numbers when the vaccines can cut into it drastically, but then I get scared if people are just not being forthright and truthful with us. And the reason I say that is I am I take care of Lihue Airport and the security, and I work with the screeners very closely. And we see some people coming in with vaccines that, vaccine cards that are questionable. And there are some places like outside of the United States where there is no way of telling whether, in fact, if it's valid or not. So there's that big question, and it raises concern. Not that, we're going to make, yell it at the top of our lungs, hey, it looks like we got something here. But it just raises concern because we're all trying to work towards the same thing, and that is making sure that we can put a stop on the spread, right? So how does it, in your position, how does it affect the numbers if people aren't truthful?
If people aren't truthful, it will basically move you from that 15 infection scenario to the 259 infection scenario. So, we're talking about a 20, 30 fold increase in the
Mm.
number of infections that we're dealing with. So yes, it is a problem. I think, the real issue, and it troubles me that, the government has been so resistant to setting up, for example, a national vaccine registry. I mean, I think such a registry should actually be set up so that people's vaccine records are actually accessible under proper privacy and security safeguards, but they can be validated against a national registry. I think that that is actually something that we should be doing, because we do need to deal with these people who are, telling us that they're vaccinated when they're not, because they are putting other people at risk. And it's the same, it also relates to how the vaccine and masking issue played out when CDC said unvaccinated people or vaccinated people could drop their mask. Then we had a lot of unvaccinated people claiming they were vaccinated and they stopped wearing masks.
Mm.
Okay, so, or use that as their excuse for continuing to not wear masks. So I
Right.
do think that it is a real problem, and I think we should develop a system. And the governor's talking now about setting something up here in Hawaii that will allow restaurants and others to verify that. And I hope that he goes through with that. He said we may have something by Labor Day, because I think something like that where you can validate, whether you bring a cell phone or you bring your Vax card or whatever, and somehow we validate it against the system. It doesn't have to reveal personal identity. It can just give you something like a QR code that you then scan, that without any identifying information being transmitted at all, basically could allow the restaurant owner to determine whether the person is actually vaxxed or not. And I think something like that would be a major step forward. And for those who are using fake vaccine cards, I'll steal a line from Jack Lord. Book them, Dano. I'm serious.
I think it should be.
I would arrest them, and basically I would throw, whatever the full force of the law we can throw at them is, we should throw it at them, because they are a public health hazard.
I think it should be made a felony with a mandatory minimum of 5 years in prison. You're talking about a virus that kills. And it's very simple to get a vaccine. So if you want to go and use a fake card, then be prepared to spend 5 years of your life in prison.
I don't know that I
Because
go
your
that
action-
extreme, but at the same time, I agree. There should be some
I mean-
penalty, and they should pay a price for it.
I would, because I think the threat or the danger of these unvaccinated people running around, typically, you could put someone in very serious.
Well, the
health
key,
or
I
death.
think, though, is, what I really want to do is I really want to move people to get vaccinated,
Mhm.
because it's also necessary for them to protect themselves. We do
Yeah.
not want them to end up being on a ventilator. And, and something like 25, 26% of those who go onto ventilators don't survive. It's a very high fatality rate for those people. And so we don't want people getting in that situation. We want them to get the vaccine. The vaccines are proven safe. I mean, we know they work, but they also have incredible community benefits in reducing the transmission, as I was showing in those slides. And I think it's really critical that we get both of those benefits. We need the benefit of the vaccine, because if we could get rid of those 90% of people in the hospital right now who are unvaccinated, our hospital system would not be in crisis right now.
Mhm.
I mean, the vaccinated
Exactly.
ones who've gone to the hospital would be a minor blip. But unless we deal with that, we're going to overwhelm our healthcare system, and we're going to continue to see the types of things we saw today with 1,035 cases statewide. We can't continue like this. We simply can't. Our healthcare system will not support it, and too many people are going to die because of it.
Well, we know it's not going to change unless behavior changes, and it won't. The numbers will continue to rise until we call it on the show the personal lockdown. We got to take personal responsibility. We got to be safe. We got to wear our masks and avoid gatherings and make sure we social distance. I mean, there's a lot of things that we individually can do. I did have a real quick question. Your chart, you showed the R0 on the original COVID was 2.7 and the Delta was 6.
Mm-hmm.
Does that change if the original person is vaccinated? In other
Well,
words,
it does change in that they will be less likely. Number one, they'll be less likely to get infected in the first place. So on the
okay,
community level, you will reduce the number of infected individuals,
yeah,
and they will probably transmit for a shorter period of time.
okay.
What we actually know, let me pull up another slide real quick just to show that. Share the right screen. Yeah, that's what I want. Come on, bring it up. Oh, okay, there we go. Okay, this is a slide I want to show you. This is actually a study that was done in Singapore. Remember I told you there's 3 countries with really great data, Singapore, Israel, and UK. Well, this is the Singapore study on Delta. Okay, and what they did was they looked at the viral load. The CT is the cycle count. It's basically it's the number of times you have to amplify the virus before you can detect it. So a low cycle count means you didn't have to amplify much. There's a lot of virus there. Okay. A high cycle count means not much virus. And basically, if the cycle count's below about, or I should say above 30, then they're not infectious. If it's below 30, there's a chance they'll infect. At 30, they'll infect about 50%, or you'll culture infectious virus about 50% of the time. And look at, this is vaccinated and unvaccinated. Okay, the vaccine breakthrough is the vaccinated people who did contract COVID. So they did catch it. And look at the viral load here, basically in the first 4 to 5 days. It's almost the same. And that means for those first 4 to 5 days, the vaccinated people who contract COVID can transmit probably just as easily as the unvaccinated people. They get the same amount of virus in the nose and throat, and basically are likely to transmit at the same level. But then their immune system kicks in with a secondary response, and their viral load drops off very, very rapidly. Out here, they're probably not going to be transmitting so much. So they will transmit for a shorter period, probably for only 5 or 6 days. Okay, whereas the person who is unvaccinated will probably transmit for 10 days, maybe 11 or 12 days with Delta, because in fact, Delta probably lasts a little bit longer because it goes to higher viral loads. So fundamentally, there is a shorter transmission period here. So the vaccinated are also less likely to transmit because they will have infectious virus in their nose at levels that can be transmitted for a shorter period of time. So it's a double win. You're kind of winning in terms of not getting infected in the first place, and you're winning in terms of transmitting it less onto other people. You can still transmit it, and especially during those first days, you got to really worry about it. But once you get past those first 4 or 5 days, you're probably not transmitting to people too often. So I do think, it's the vaccines are a win on the transmission side in several ways.
Got it. Thank you. That clarifies a lot. Again, the data, you mentioned it, some of the countries actually do really good with keeping the data. I just don't understand with the technology and the supposed brains in our country who should have been able to track, or they should have had opportunities to do so. And they
Well, I hate to
didn't.
say it, but since day one, we've had problems. I mean, CDC screwed up the testing in February and March of last year. We could have imported tests from the Germans. The Germans would have been happy to sell us tests at that time, but American pride would not let us basically import the WHO approved German test because we had to develop our own. And as a result, during the early stages of the epidemic, we were totally blind because none of our states had the ability to even track COVID at all because we didn't have an approved US test. And so I think, it's been a problem from day one here in this country. We haven't beefed up our data systems. We haven't beefed up our analysis. We haven't done what we need to be doing for a once in a century pandemic. And I think that's been a real issue across the board.
Mhm.
Well, that hour went by really quick. Gosh, we need 3 hours with you, Doc. Hey, I got a real quick question. And you talked about the wave of hospitalizations, and this will be my last question, and we'll wrap it up. The wave of hospitalizations comes, I think you said 10 days or so after the cases.
Right.
And then the wave of deaths will follow. Looking
About
at
2 weeks after that. So
correct. So looking at where we're at right now, where we're basically at 120% capacity, we're over capacity at all of the hospitals. Our cases are rising. 10 days from today, we're going to have a big problem with hospitalizations, and 2 weeks from then, we're going to have a bunch more people die.
The unvaccinated ones will be dying. Yes.
Yeah, unvaccinated. Yeah, let's make that clear. What if you had, if it was up to you today to curb this, what would your recommendations be?
Honestly, at this point,
Yeah, right now.
I would probably go into a lockdown. I mean, I realize, the governor has a lot of other things he's got to consider. You can't disregard the fact that we've got a couple 100,000 tourists in Waikiki right now and on the neighbor islands. So, it's difficult to just lock down at this point. Where would they eat, for example, if we closed all the restaurants? So I think, there are a lot of different factors that come into play. But again, we need a circuit breaker at this point. I mean, just look at that graph of what's going on with our new cases. We had 1,000 new cases today, up from 800 and something yesterday. So, and it's probably going to be, at that level or higher for the next couple of days. Then it will drop off again because then we're getting the weekend cases, and those always drop down because testing's less available. But I do think, we're in a critical situation now, and we need to take some extreme steps. At the very least, I would be, for example, reimposing work at home orders where I could, asking businesses to have people work at home if possible. I'd be asking people, like you say, personal responsibility is important here. We basically should be reducing our movement. We should definitely be avoiding any crowded indoor situations. We should actually be doing takeout instead of going to restaurants. That would be a much smarter thing. And I think, there is, and of course, we should be masking always. Okay, outdoors, if you're away from people, maybe not. If you're near a crowd of people, even outdoors, I would be masking. I would also recommend upping the quality of your mask. If you can get N95s, buy them and use them. This one is much more contagious than the variants that were around last year. And so I do think personal responsibility has to be part of it as well. Now, the concern I've got is I think a lot of our issue has to do with age, because a lot of our unvaccinated individuals are those people basically below age 40, 39 and down. That's where our vaccine rates are lower, closer to like 50, 60% instead of the 70, 80, 90% that we're seeing among the older people. And that is also the group that is probably much more likely to be out there in the restaurants, not wearing their mask, chatting it up. And I think that is a major issue. They also have a sense of their own invulnerability. And I think, that's been part of the problem. It has been fed by this narrative that COVID does not affect young people. And that's been a false narrative from day one. It affects young people less than it affects the elderly, but it still affects them. And they still end up in the hospital in some cases, and they still end up dying in some cases. And some of them will end up with long COVID. They will end up with a fatigue that will last at least a year, if not longer, and may end up being a lifetime effect. Those who get hospitalized, in one study in the UK, 40% of those hospitalized suffered some kind of systemic organ damage, whether to the lungs, to the heart, to the kidneys, to other organ systems. Those are lifetime effects. They will be with you for the rest of your life. So the people who fed the false narrative that COVID does not affect young people, yes, it affects them less than it affects the elderly, but it still affects them. And it can affect them in life-altering ways. And I think that people need to understand that. We are now with Delta very concerned. Again, it's anecdotal because we don't have good data systems, but we are very concerned that it may be affecting children more than previous variants did. I mean, you're seeing the stories now in the pediatric clinics in Louisiana, in Mississippi, in Texas. There was a story on CNN about a week ago talking about how they had to fly one child 150 miles to find a pediatric ICU unit because every other hospital that was closer was already full. So there's no question that children can be affected here. There's also multi-system inflammatory syndrome that basically can produce life-threatening effects on children, and again, potential organ damage if it's not caught early and treated early. So young people are affected by this, children are affected by this, and the false narrative that they're not is part of the reason why I think people feel so invulnerable at this point. Other than the normal invulnerability that all the young always feel. When we're young, we always think we're never going to die. And we're old, we always think we're going to die tomorrow. So, it's...
Yeah, I got two of them young kids.
Part of the life cycle.
It is. Well, Doc, thank you very much. what an amazing. I'm watching the comments. That's why I look off the screen, and there's just a lot of appreciation from our viewers. We'll definitely want to get you back on at some point, but appreciate your time, Charlie.
Well, I like to say again, thank you to our esteemed guests. It's always a pleasure to listen to everything that he says. Factual, bringing out a lot of thought-provoking information, because for some of us, we've never delved into something from this end. We just hear what we hear what or see on the news, but to have facts that's placed and explained, really, it seems complicated at first, but it's very simple to understand. And we can see with a graph, it tells us that if we don't buckle down, ladies and gentlemen, right now, from what our guests have talked about tonight, we are going to be in a world of hurt. And I think, there have been many individuals over time, since Mel and I have been doing this for nearly 18 months now, that have felt that we only promote fear. No, again, we're giving you the information, whether you want to take it or not. That's totally up to you. But don't cry if something happens and try to claim that, oh, I didn't know. Because we are just one of many messengers that finds it very important to put out the right message. Because as Tim said, there's a lot of false messages given, and it's caused a big problem. It put us behind the 8 ball. Okay. So now's the time to buckle down and do what you need to do as adults or heads of your families to take care of everyone. And that includes from Kupunas all the way down to the Keikis. If we say we love our islands, then we have to learn how to take care of our island. And that includes the people who live on it. We have to be responsible, and we have to make sure that we can cut the head of this dragon off so it doesn't spread anymore. But it's going to take everyone. It's not a few. It's going to take everyone. So thank you very much for joining us, Mel.
All right, Doc, any closing thoughts, Doc, before we sign off?
I think Charlie summed it up pretty well there. I think, we all have to take responsibility for this. Our leaders need to step up and take responsibility for their part in this. And together, I think we can deal with it. But we have to actually act. We can't just sit on our hands and not do anything.
Yeah, and I think that's what we have been trying to. And a lot of you guys are saying, hey, this should be on the news. Dr. Brown has been on the news. Dr. Brown has been all over the place, including many other experts, sharing the message of everybody. Guys, we got to do our shit. Got to do our part. We got to get vaccinated. I saw a good friend of mine today, Bozu Anama. I can say his name because he posted a Facebook Live on today. He's a bus driver. I don't know if you guys know Bozu. He's a bus driver for Honolulu. COVID. He's in the hospital, 70 liters of oxygen, and he's begging people. A very emotional video, begging people to please go get vaccinated. You do not want to get this. And it's hard for me when I see my friends or loved ones that are begging and saying, you just do not want to get this virus. And please, guys, like Charlie and I would never force anybody or we're just trying to keep our community safe. And as you saw in the charts today, the very brief time we've had with Dr. Brown, that vaccine will help. So guys, we love you guys. We thank you guys. Dr. Brown, I cannot thank you enough.
Yep.
And I hope we can get you back on at some point. We'll see how this thing plays out, and hopefully we see some positive changes being done. So with that, folks, you guys all take care, stay safe, enjoy your weekend. We'll be back. Stay in touch. I'm not sure when we'll be back on because my flight schedule, I got to get back home. So we may not have a show until Tuesday or so. I'll let you guys know. All right, guys. You guys take care. God bless.
Aloha.
Okay, aloha.